After the transplant, all patients will be taken to one of our lung transplant intensive care units. All patients will have a breathing tube connected to the ventilator, have large IVs in their neck, and will be sedated. This is all very normal. We will do our best to remove the breathing tube as quickly as possible, but every patient has a different post-surgical course, and some patients will need the breathing tube longer depending on the overall function of the lungs. Additionally, some patients will need another form of life support called ECMO. This stands for extracorporeal membrane oxygenation, and often this device is called the heart and lung machine. As the name implies, this machine can be used to support the heart, the lungs, or both as the patient recovers from surgery. It adds oxygen to the blood and it removes carbon dioxide so the heart and the lungs can rest. Most of our patients do not require ECMO, and the breathing tube is removed within the first 24 to 48 hours after surgery. In addition to the breathing tube and the large IVs, patients will have several chest tubes, blood pressure and heart rate monitoring devices, and a Foley or a urine catheter. As you wake up from sedation, there will be nurses, respiratory therapists, doctors, nurse practitioners, and your family at bedside. They will be giving you reassurance about the surgery and orienting you to what is happening. Pain control and comfort are one of our top priorities because this will allow you to start moving and walking very soon after transplant, and in some cases, even the same day. During the operation, our surgeons perform nerve cryoablation, which provides a long-lasting anesthetic effect to the chest wall where you will have the incision and the chest tubes. This procedure is very effective for pain control, and it helps us limit the frequency and the use of opiates that are needed. In rare cases where cryoablation and oral pain medications are ineffective, we have the option to place an epidural catheter. While you are in the ICU, all patients will undergo bronchoscopies within the first 5 days, and thereafter it will be as needed. This is a procedure that involves using a scope to look at the new lungs and clear out any secretions that have accumulated. Next, let's discuss time in the hospital. All of our patients will spend a minimum of 4 days in the ICU. During that time, we are working on physical and occupational rehabilitation, starting the immunosuppression regimen, and weaning off the various machines and devices. Once we've determined that the recipient is stable to leave the ICU, we will transfer them to one of our step-down units. This is the time in the hospital course where we focus on physical and nutritional rehabilitation, ensuring that all medications are well tolerated without side effects, and finally begin discharge teaching. It is expected that at this juncture, the family members and caregivers make themselves available to the team for multiple days of education session. Transplant is a new life, and with that, both the patients and the caregivers must learn how to live in this post-transplant world. Education is critical to understanding the new medications as well as the lifestyle changes that accompany transplant. Typically, patients are on the step-down unit for 7 to 10 days. Our average hospitalization course from surgery to discharge is about 2 weeks. If there are complications, this may be longer, but rarely is it shorter. We understand how overwhelming this hospital process can be, and our entire team will be with you and your family every step of the way. Taking care of your new organs is a shared responsibility between you, your family, and the UCSF Lung Transplant team. Together, we can ensure a successful path in your new life. Thank you so much for listening, and congratulations.